I hope I am audible.
Namaste, sir. Yes, sir.
So, welcome all of you. Today, we are doing Anupurvi 27th edition. Welcome all the internees, PG scholars, practitioners, academicians, and their friends. All these days, we were taking some other clinical points, some of the medicines we were discussing. But today we
This
are
call is
working
now being
on
recorded.
some of the useful clinical tips or useful clinical classical yogas effective in apasmara chikitsa. So the convulsion, seizure disorder, or epilepsy is a commonest clinical condition which requires a lot of expertise to handle. As an internee or a PG scholar in the ward or in the OPD, anytime you can get or come across with such cases. Epilepsy is a disease of electrical imbalance in the brain. Many times it is a functional disease, so many times it doesn't have any organic lesion. But in some of the cases, usually CT MRI scan of the brain will be normal in many instances. EEG will be normal in many instances, still they suffer with epilepsy.
This call is now taking notes.
Sometimes we have seen that in EEG report, it is not necessary that all patients of epilepsy will have abnormal EEG pattern. Alpha, beta, gamma, theta, delta waves are there in EEG, and no rule that EEG normal report cannot rule out epilepsy disease. So this is to be clinically correlated. So whenever a patient comes with EEG report normal but epilepsy is present, CT MRI scan of the brain is normal but epilepsy is present. The convulsion disorder, convulsion can be a tonic-clonic convulsion, or sometimes it is a Jacksonian pattern, sometimes it is grand mal, sometimes it is petit mal, sometimes it is focal epilepsy. In all of them, the basic problem is the electrical supply from the brain to the periphery is suddenly discharged. When electricity from the brain is suddenly discharged in high quantity, then person suffers with the epilepsy or convulsive disorder. After epilepsy, if patient gets jara, it is one of the condition. In another instant, firstly jara comes and then convulsion comes. Firstly, jara comes and then person develops. Usually in pediatric practice, convulsion starts. It is febrile convulsive disorder. If convulsion first comes and then body temperature rises, it may be pittanubandhi apasmara lakshana. In apasmara, the classical text in Ayurveda gives more focus on tīक्ष्ण shodhanam and then rasayanam. Normally, in apasmara samprapti, there are 2 times avarana happening in Hridaya and Hridaya Vasrotas. That's why Acharya Charaka has rightly told that Tairavrutanam Hrutsroto Manasam Samprabodhanam Tikshnai Radho Bishak Kuryat Karmabir Vamanadivihi. So in Vata Basti, in Pitta Virechana, and in Kapha Vamana, is a general Shodhana Chikitsa required, and in all cases of epilepsy, convulsion disorder, Medya Chikitsa, Mastishke Upakramas like Shirodhara, Shirobasti, Shiropichu, and Shiro Abhyanga are required. Nasya Karma is very important line of treatment for convulsion disorder. Along with modern medicine, if you put 2 drops of Panchagavya Gruta or 2 drops of Tiktakam Grutam or 2 drops of Murchita Tilatailam, Murchita Grutam, if you don't get anything, use Shuddha Go Gruta. Pure cow's ghee, 2 drops if you install in the nose every day, morning and night, many people will have very good response. If you get Purana Grutam, 1-year-old Gruta, 5-year-old Gruta or 10-year-old Gruta, if you put only 2 drops of Purana Gruta into the nose, convulsion episode, severity, its duration will come down. We have seen such cases one of our Vaidya has given Purana Gruta to my PG scholar. We used to use it in emergency. 2 drops Nasya as a Pratimarsha Nasya will prevent or reduce the episode of epilepsy. So today I remember late Professor Dr. C.P. Shukla sir, my teacher and mentor in Gujarat Ayurveda University, Jamnagar. Sir's favorite Charaka's prescription for apasmara was this. So I want to share that with all of you. Prayunjat Taila Lashanam Payasa va Shatavarim Brahmi Rasam Kushtarasam Vacham va Madhusamyatam Duschikitsyo apasmaraha Chirakari Krutak Spadaha Tasmad Rasayanaihi Enenam Prayashaha Samapacharet. In almost all of the epilepsy patients, these 5 prescriptions, any one can be used. We will learn this today, one by one. So number 1, Prayunjat Taila Lashanam. Taila Lashana Prayoga is very effective in apasmara, unmada, atatvabhinivesha, major and minor psychiatric disorders, depression and smrti vikaras. How to use this Taila Lashana Prayoga is, take sufficient dose of Lashuna, freshly collected Lashuna. 3 pieces or small pieces of Lashuna should be taken, crush them with a stone, and then add hot tilataila, ushna tilataila, boiling tilataila on that crushed garlic, mix it and consume it. This is one of the best prescription Professor C.P. Shukla sir was telling. It is going to stop convulsions of various types, many types. In spite of modern diagnosis is confirmed, modern diagnosis is not clear, EEG is normal, EEG is abnormal, or CT MRI may be normal or abnormal, it is grand mal, petit mal, whether they are increasing the dose of eptoin or phenobarbitons, CNS depressants, any modern psychiatric or neurological drug is going on. Along with that, as a dietary supplement or food supplement, food grade medicine like Taila Lashana Prayoga is found effective. I tell many of my patients to use this at home, and people are doing this and getting good results. If it is a petit mal case, do this Taila Lashana Prayoga in the Pratama Prahara of Ratri. If this disease is grand mal and coming with furious episodes of tonic clonic seizure, then do it in the daytime and nighttime both. When there is unpredictable vega of apasmara, apasmara is usually treated with vega kalina chikitsa and avega kalina chikitsa, and usually before full moon day and before no moon day, these aggravation of these lakshanas are expected as per classical presentation. And even in some of the grahavesha, amanushoprasarka and grahavesha also causes these seizure disorders. Even though it is apagataha smaranam, transient loss of sudden consciousness and understanding of the surrounding and environment is seen in this. So the best prayoga is Prayunjat Taila Lashanam. Lashana Kalka mixed with Ushna Tila Taila will be giving a very encouraging result I have seen. In Lashana, what I want to highlight is this is a Pancharasatmaka, Amla Rasa Rahita, Pancharasa Yukta Dravya. It is Urdhva Adashodhana drug. Lashana is having one Kali Lashana and multiple Kali Lashanas are available, and Girija and Kshetraja, 2 types of Kashyapa says Lashanas are available. Lashana is rich in calcium, Lashana is rich in iron, Lashana is rich in vitamin C. Allyl propyl sulfide, diallyl disulfide allicin 1 and 2 are major chemical alkaloids present in Lashana. Lashana is Katu Kashaya, Lashana Kanda is Katu Rasa, Lashana stem is Kashaya Rasa, Lashana leaves are Tikta Rasa, Lashana tip is Lavana Rasa, Lashana fruits are Madhura Rasa. We are using for the purpose of this Taila Lashana Prayoga, we are using the Lashana Kanda only. The alcoholic extract of Lashana bulb showed anti-inflammatory activity against carrageenan-induced hindpaw edema in albino rats. Alisatin showed significant inhibitory activity against formation of arthritis. Garlic juice and essential oil extract were found to have protective action against fat-induced increase in serum cholesterol and plasma fibrinogen and decrease in fibrinolytic activity and coagulation time. Extracts of the leaves, stem and bulb produce stimulating followed by inhibitory effect on the uterus of non-pregnant guinea pigs and stimulating effect on uterus of guinea pigs. Diallyl trisulfide shows antimicrobial activity. Blood cholesterol level was significantly decreased in human subjects after 2 months of ingestion of garlics. So with these properties, we should understand Lashuna as one of the best rasayana. Only in Pitta Prakopaja and Pittanubandhi Apasmara it has got a limitation. Otherwise, Avaranajanya Apasmara, Avaranajanya Unmada, Agantuja Unmada, Agantuja Apasmara, all types of apasmara, epilepsy, convulsions can be treated with Prayanjata Taila Lashanam. So this Taila Lashana Prayoga is effective. Second is Acharya Charaka says Payasa va Shatavarim. See, these are out of the box thinking prescriptions in apasmara. These are not medya. Shatavari is not medya according to general understanding. But I'll tell you the effect of Shatavari is also documented as medya. So Shatavari, Payasa va Shatavarim. This method of administration and dosage must be kept in mind. In case of epilepsy of any category, Shatavari Kalka should be given with Gokshira. So this prescription should not be missed. Shatavari Swarasa, freshly collected Shatavari Swarasa is the best. If you don't get that, Shatavari Churna should be mixed with milk. This is second option. See, first option is freshly collected Shatavari Swarasa mixed with milk is one of the best option. Either Gokshira or Ajakshira can be selected as the case may be as per the availability. Then Payasa va Brahmi Rasam, Payasa va Kushta Rasam is another prescription. First drug is Prayanjat Taila Lashanam. Second is Payasava Shatavarim, Shatavari Churna with milk, Shatavari Swarasa with milk, or Shatavari Kshirapakam. 3 important dosage forms can be manufactured as per the case may be, as per the physician's availability, and in your OPD and IPDs, easily you can get Shatavari Churna and mix it with milk and give to convulsion patients. And dose is regular dose 3 to 6 gram of Shatavari Churna mixed with 100 ml of milk, or 30 to 40 ml of Shatavari Swarasa mixed with 120 ml of milk can also be administered. Taila Lashana Prayoga, Taila 20 ml and Lashana 20 gram can be given. And administration time is Vyana Vayu Kala, that is morning before food when previous day food is digested. Brahmi Rasam, there is 2 interpretation, Payasava Shatavarim Brahmi Rasam Kushta Rasam, or Vacham va Madhusammitam Brahmi Rasam va Madhusammitam Kushta Rasam va Madhusammitam. These are the permutation and combination. Shatavari Swarasa can be given with Madhu. Lashuna Swarasa can be given with Madhu. Lashuna can be given better with Tilataila, Ushna Tilataila mixing. Brahmi Rasam, Payasa Brahmi Rasam. This is Brahmi Rasa should be mixed with milk. So Brahmi Swarasa should be taken here. Brahmi Swarasa, Brahmi is of 2 types, Mandukaprani and Jalabrahmi, Aindri. Both are available in Karnataka. So Mandukaprani Swarasa is second option. First option is Bakopa Maniri. Aindri or Jalabrahmi Swarasa should be taken. Swarasa is mixed in cold, boiled and cooled milk. See, Shatavari Swarasa can be mixed with boiled and cooled milk. Brahmi Swarasa can be mixed with boiled and cooled milk. And this Brahmi Swarasa 30 to 40 ml mixed with 100 ml of milk can be given, or 30 to 40 ml of Brahmi Swarasam, Mandukaprani Swarasam mixed with 10 ml of Madhu and given to the patient early in the morning before bedtime. And Kushta Rasam va Payasa, Payasa Kushta Rasam. Kushta is Asura Lepa. Before going to Sasura Leppa, Shatavari is Mudaram Tiktam Madura Vipakam and it is Shitavirim, Vatapitta Prashamanam. Whenever patient is having associated with Ushnata of the body or Pitta Anubandhi Lakshana, Jwara Anubandhi Lakshana, Shatavari's first property is told as Medya, Vedana Stapana, Shulahara, Grahi, Hrudya, Shukrala, Garpa Poshaka, Stanya Janana, Mutrala, Balya, Rasayana and Chakshusha. So these properties of Shatavari can be used in the management of apasmara roga. Next comes is Kushta Rasa. Kushta is Asura Leppa, Changal Kosta in Kannada. The Tamil Nadu sample of Changal Kosta is clinically trialed. Authentically, it is adulterated in many cases. So Kushta is Asura Leppa. Chennai based supply, you will get good quality of Kushta. Kushta Swarasa cannot be get because it is a rarely available drug. Kushta Kwata can be prepared, and Kushta Kwata boiled and cooled can be mixed with equal quantity. 40 ml of Kushta Kwata, 1/4 reduced Kwata mixed with 100 ml of milk can be given. Shita Shita Kshira can be mixed with Kushta Kwata. Or Kushta Churna can be mixed in 10 to 12 grams of Kushta Churna mixed in the milk can be given early in the morning and before bedtime. And Kushta is a powerful anti-inflammatory analgesic, Shukra Shodhana, Shukra Janaka, and it is anti-cancer drug. Kushta is Jwaragnam, Kushta is very good Katupostika Rasayanam, and it is a very good drug for cancer, from any general inflammation to dysplasia to metaplasia or pre-cancer and cancer. Kushta Churna works very well. Kushta is Medya, Tikta Katu Medya, and hence Kushta Churna with milk or Kushta Churna with Madhu. Kushtam va Kushta Rasam va Madhu Samyitam. The Kushta Kwata mixed with honey, Sutashita Kwata mixed with honey, or Kushta Churna mixed with honey can be prescribed. 12 grams of Kushta Churna mixed with 10 ml of honey and given to the patient morning and night. This is also found effective in many of the apasmara cases. What is the intention of telling Charaka's 5 prescriptions in apasmara is none of them are direct anti-convulsion drugs. They don't fit in the general rule of anti-convulsion CNS depressant, but they are having a profound prabhava and they are having their specific action for Samprapti Vigatana and Amshamsha Kalpana specific action in apasmara or convulsive disorders. Next comes is Vachamva Madhusamyitam. This is also one of the best rasayana we can prescribe. Vacha is Sangna Stapana drug, Vedana Stapana drug. In Charaka, Sutrasthana 4th chapter, many times Vacha Churna has come. Vacha Churna is effective in Unmada, Apasmara, Vishada, Atatva Vinivesha, Smriti Vikara, and other brain and neuropsychiatric illnesses. A fine powder of the freshly collected Vacha Churna should be taken. Vachamba Madhusamyitam, here Vacha Churna can be given. Vacha Kashaya if you give in high dose, or Vacha Churna if you give it in higher dose, because it is a Vamanopaga, chances of Chardi and Vamana is possible. If at all it happens, don't worry, its dose can be reduced by some 20 to 30%. What I prescribe is, we ask our patient to take freshly collected Vacha Churna mixed with Madhu and taken early in the morning and night. It is having definitely central nervous system action. It is anti-anxiety, anti-depression, and also it is a mood stabilizing drug. It can be given in bipolar mood disorders. It can be given in manic depressive psychosis. It can be given in neuro or psychoneuro conditions like Unmada, Apasmara, Tattva Abhinivesha, Agantaja Unmada, Agantaja Apasmara. In all cases, this can be prescribed. But I have not tried mixing up of 2 or 3 in any case. I have used either Vachamva Madhusamyitam alone, Kushta Rasam va Kshiram, Kushta Rasam va Madhusamyitam, Brahmi Rasam va Madhusamyitam or Brahmi Rasam va Payasa or Prayanja Taila Lashanam, Taila Lashana Prayoga. We have independently used all these things and we found that patients are going to improve whenever these 5 prayogas, any one can be used. But what I do is, I know that modern doctors write many of the phenytoin sodium or recent sodium valproate like drugs for longer duration. So whenever modern drugs are prescribed for a longer duration, maybe 3 years or maybe 5 years, as an add-on therapy, these Prenjat Tailalashanam, Payasava, Shatavarim, Brahmi Rasam, Kushtarasam, Vachamba, Madhusamyutam, these 5 prayogas can be used in a circular fashion. I'll tell how I use. When patient comes, initially we decide whether he is fit for Shatavari, he is fit for Brahmi, or he is fit for Kushta or Madhu, Vacha or Lashana. Whenever Kafavata Pradhana Apasmara is there, whenever patient takes long time to recover from the episode of tonic-clonic convulsion, we call it as Kafa Pradhana Apasmara. Then we start with Taila Lashana Prayogam. 48 days, one mandala prayoga of Taila Lashana is advised to such patients, followed by Vachamva Madhusamyitam, then Kushta Rasamva, Brahmi Rasamva, and Payasa Shatavarim. Once in 48 days, after giving 48 days of Taila Lashana Prayoga, give a break of 7 days, give one Sadhya Virechana, and then start next drug. So these 5 Rasayana Kalpas can be repeated once in 48 days, give a gap of 7 days, and again one Sadhya Virechanam, and then start. Or at the end of Shirodhara, Shirobhasti, Shiro Pichu, you can start any one of these yogas. We keep on shuffling one by one. All 5 will be prescribed. So a course of 60 days into 5. This much of long run we prescribe, then it is called one prayoga, one pancha prayoga in epilepsy. And if you want, give 15 days gap and again start giving these kalpa prayoga in a circular fashion. Because 3 years or 5 years, every time patient says only one medicine is given, so they feel monotonous drug cannot improve. Then make this 48 days course, give a gap of 7 days, Sadhya Virechanam, and then start. Then adaptation effect will not be there. Another drug will be shuffling. The brain entry level of Lashana is very good. Entry of drug into brain is also good with Vacha Churna. Vacha is Pramati drug. There are only 2 Pramati drug. One is Vacha and another is Maricha. So Vacha Churna with Madhu will go to the brain's neurological network where there are blocks, where there are conduction defects, where there are tau protein blocks or even iron molecule protein blocks. These undigested protein deposition in the cerebral network is also cause for Alzheimer's disease, dementia, smriti rasam, unmadam, apasmaram, madattvabhinivesham. Then we prescribe Prayinjat Taila Lashanam first. When Kapha Lakshanas are more, Kaphavrata Vata Lakshanas are more, Kaphavata Hara, Lashana Taila Prayoga, Ushnam Tikshnam Katu. This prescription is asked to take by patient, and then we keep on shuffling. Payasava Shatavarim, Payasava Brahmi Rasam, Payasava Kushtarasam, Vachamva Madhusamyutam. Or we also make Lashana Kshira Prayogam. If patient is in Shita Rutu, according to Rutu, instead of Taila Lashana, what we do is Lashana Kshira Paka is told at night time before bed. When Varsha Rutu and Shita Rutu is there, Shishira Rutu, Hemant Rutu is there, Lashana Kshira Paka is also told. Because Lashana Kshira Paka is very good for Shita Rutu, Katu Ushna Rasa Pradhana, Srota Sangam Vinatti. And this Katurasa is going to open the blocked Srotasas. Srotavaroda is cleared, Sroto Sangha is cleared, and it is going to work very well with apasmara. So apasmara is not just a convulsion, epilepsy, or tonic-clonic seizure disorder. Apasmara is more than that. It is a Sannipataja Roga where Tishna Shodhana is expected. Hence, Taila Lashana Prayoga becomes a very effective line of treatment in apasmara. So, whenever you are using any of your apasmara hara modern drug or apasmara hara Ayurvedic treatment is going on, just give these importance to pancha prayogas in apasmara. So, to come to summarize, today we have discussed about understanding apasmara. Apasmara is a convulsion disorder. Apagataha smaranam is pradhana lakshana. Tairavritanam hrutsroto manasam sangna prabodhanam. Where avarana is a very important thing. Sangna vasrotas, vatava vasrotas, and even Chetana vasrotas is having avarana with kapha, ama, meda, and other doshas or doshas. Then it is also called Malarogam. In Karnataka, it is called Malarogam, and it is due to the imbalance in the electrical supply of brain into the central nervous system. When sudden discharge of electricity is there from the brain, then there is convulsion. Convulsion is a protective reflex of the brain to get itself corrected back. It is not a bad thing. It is one of the physiological response of the brain to cure itself back. So in that, usually serum electrolytes must be checked, serum lithium, serum magnesium, manganese should be checked very well, thyroid hormones must be checked, CT MRI brain, electroencephalography, ECG and cholesterol lipid profile must be checked in these cases. Hypothyroidism with apasmara, diabetes with apasmara, hypertension with apasmara, and febrile convulsive disorder, graha avesha, amanusopasarga, agantaja apasmara, all of them should be kept in mind. And whenever patient gets a status epilepticus, then a tongue care is important. The secretions, phenodgamam, phena vamana, phena should not go to the oropharynx or nasopharynx, and check that the tongue bite will not happen. In status epilepticus, less than 3 minutes or 5 minutes is not emergency. If it is more than 3 to 5 minutes continuous convulsion, it should be referred to modern doctor or modern medicine like diazepam injection is expected. And once the patient is stabilized, during in between two vegakala, vegakalina chikitsa is tikshna shodhana, navananasya, kapila gomutra nasya is also told, and we can use so many kalpas in apasmara like smriti sagara rasa, tantu pashana, and Meetha Chatushka Prayoga of Acharya Charaka, Saraswatarishtam, Saraswata Churnam, along with allopathy drugs, these can be given. And Panchayoga plays very important role in Unmada Apasmara. So Prayunja Taila Lashanam, Lashana Kalka mixed with hot Taila, Payasava Shatavarim, Shatavari Swarasa, Shatavari Churna, Shatavari tablet, Shatavari Gruta with Kshira or Shatavari Kshirapaka. Third is Payasava Brahmirism, milk mixed with Brahmi Swarasa. Backup of Maneri is best, or Mandukaprani can also be taken. And Payasa Kushtarasam, Sasura Leppa Kashayam or Sasura Leppa Churnam, and Payasa Vacham, Vacha Churna mixed with milk can be given, or Madhu mixed with Brahmi Swarasam, Madhu mixed with Shatavari Swarasam, Madhu with Lashana Churnam, Madhu with Kushtarasam, Kushta Kashayam, and Vacham Madhu Samhitam. One of the best Pramati Rasayana, Vacha Churna mixed with honey can be given. Even Vacha Churna Potali Agrana, just taking smell also prevent the onset of or severity of convulsive disorder. With this, we come to the end of today's Anupurvi 27. If there are few questions, we can take. Otherwise, thank you one and all.
Sir, thank you, sir, for wonderful session. Sir, one question is there. Sir, in febrile convulsion in kids, which of these can be used, sir, for further prevention?
Shatavari Kshira is very good for children because they are Sukumar. But at the same time, Brahmi Rasa with milk or Madhu can be given in children.